After nearly 1 year of the coronavirus pandemic, many adults report delaying medical care for routine or serious non-COVID issues. Joining us right now on the need to try and encourage regular medical care and communication is Gary Loveman. He's the CEO of the health startup Well. Gary was the longtime CEO of Caesars Entertainment, and he knows a lot about people's behaviors and the incentives for consumers. Gary, I want to thank you for being here today. It's good to see you.
My pleasure, Becky. Good to be with you.
When I first heard about this app, I thought it was going to tell me to do things like more sit-ups or go for a run or something. But this is really aimed at making sure people are getting to the doctor's appointments that they should be scheduling, right?
Yeah, you're right. This is a clinically based platform that tries to build a high level of engagement with its users and encourage them to take the actions that will advance their health. The biggest problem in American healthcare, and I think generally across the world, is that people do not do simple things that would advance their health. And this is not simply diet and exercise. This is things like preventative medicine, including vaccinations, appropriate diagnostic tests, doing things that manage chronic conditions in a way that's consistent with best medical practice. And what they need is a platform that's constantly sitting on their shoulder like a benevolent force, an angel, if you will, that is saying to them, hey, Becky, these are the things you ought to be doing. I want to remind you that these are very important to you. Here's how we can help you do them. Here's a little reward and support for taking the right actions, and encourage people to live as healthy a life as they're capable of living.
Gary, we mentioned that you're the former CEO of Caesars, but you were also the former Aetna president of Consumer Health. And I think you put those two worlds together with this app. What did you learn about people's behavior when you were watching them in the casinos, things like the loyalty programs that help when you try and convince people to actually engage with this app?
Well, two things, Becky. First is that in the healthcare world, most Americans visit a doctor no more than once or perhaps twice a year for a very brief period. And their doctor or nurse may tell them there are things they should do, but often those actions are time-consuming, costly, inconvenient, sometimes not very appealing. And the notion is that simply having been told to do these things, people will immediately respond and do them. Yet the data shows that, by and large, people don't do them. In the casino business, we never went at it that way. We asked people to do things over and over again. We tried to find the way that made those ideas appealing to them. We tried different prices, different promotions, different assortments of services, until we could encourage a person to take the action that we hoped they would take. We need this in healthcare. So if you're having trouble remembering or taking on the task of getting a test that's important for your chronic condition, you need to be told repeatedly, encouraged, rewarded, and cajoled in a positive and supportive way that these actions are necessary. So it's really the application of the same kind of consumer science that we applied in hospitality and gaming now to healthcare, where the stakes are obviously much higher.
Look, I get what you give me when you're trying to get me into a casino. Maybe you offer me, some free chips or something along those lines. What's my reward if I do these things and make sure I make it to all my doctor's appointments?
Well, there are two levels of reward here. An extrinsic reward is actually a valuable reward. It's points that are translatable into things like gift cards or access to services or products that appeal to you. And the intrinsic reward, which is in many cases more important, is the notion that for the first time, you're being successful in pursuing your health. So we've asked you to do something. It's usually rather modest. You've done it. We've recognized you for it. You've had a success with it, and now the likelihood is you'll take another action, perhaps another small one, in the direction of becoming more adherent with your health. And for many Americans, healthcare is not a very successful experience. So to the degree we can build a cycle of success, repeated exercises to do the right thing to improve your health, it becomes easier and easier to continue to do that.
Shepard Smith here. Thanks for watching CNBC on YouTube.